All right, so we're going to look at some Nclex testing strategies. Let this serve as a notice to all that this is not the absolute trick or a magic training to help you solve every Nclex question correct. Remember, knowledge is the key to passing your Nclex. So you can't use only testing strategies to pass your exam, right? Think during the last introduction we did, we were saying things like, all that I'm saying right now, we said some of them. So this lesson is just to help some of us overcome some questions, okay, especially when we reach a point where we are stuck and our knowledge about what is being asked can't be found. So you can use some of these petty things. So this is just to draw attention to one or two few things, okay? So let us begin. Sometimes when you are testing, you may know an answer immediately on reading the choices. There are other times too, you may need to choose an answer without being certain of what the answer should be. So in those situations, like I was saying before, we have some tips to help you do your elimination properly, okay? So that you can at least put some choices aside, choices which are unlikely to be correct. So we might use some of these strategies to dissect some complex nursing questions and to help improve our Nclex testing skills, okay? So the first thing to talk about here is do not read into the question. Do not read into the question. I think, and I also believe this is not the first time of hearing this. Do not read into the question. What does this one mean? Never assume anything that has not been specifically mentioned in the question, and do not add any extra meaning or history to the question. In other words, do not make up a story to validate choosing an answer. Some of us, we might end up doing comparisons, right? Or there are some of us who try to change the questions before us in our minds. So it's like we set our own questions with what has been given to us. Then we devise our strategic own answer. And mind you, I have said this before and I'll say it again now. For even the wrong answers on your Nclex, even with the wrong options, they have been well calculated for. Okay, they have been well calculated for. So they will not give you something strange, which is off board. They might give you things which are very, very, very closer or almost similar to the answer. And that will lead you into a more confusion state. So that is where you have to pay attention to. Okay. So in your Q banks and on your dashboard schedules with your test, when you start practicing or you have been aware of some of these things, it might help you. Okay. All right. So do not read into the question. Can someone mute up for us? Reading into the question, sometimes, you see, we are saying you shouldn't assume anything that has not been specifically mentioned in the question. So sometimes, especially for prioritization questions, they can give you, let's say, someone who is asthmatic and someone who is having chest pain. Look at these two things. Someone who is asthmatic. Okay, so we continue. I was trying to compare someone who is asthmatic and someone who has chest pain. When you have two situations like this, which one will you prioritize? You might think that asthma is of concern to the airway, right? And someone who has chest pain, I mean, if not anything, you can relate it to circulation. So using your ABC, someone might be tempted to choose asthma. But in this case, what is happening here? Chest pain is like it's a situation which describes the state in which someone is. Okay. It describes a state. When someone has chest pain, it means there is pain in the chest. And when someone has asthma, the question hasn't informed you that there is an exacerbation. In fact, asthmatic people don't always work with exacerbations. So always look at the question exactly as it is. Chest pain means there is pain in the chest. Asthmatic means the person has asthma. And the person has not told you that the patient is having exacerbation or maybe a reaction out of it. So you prioritize that which is there. Okay. You don't assume that the asthmatic patient which has been mentioned, okay, the asthmatic patient who has been mentioned in the question is having exacerbation. So you don't do your comparisons like that. So look at what is in the question, exactly what has been given to you, and try and do your comparison. Also, they can give you situations where you will have to make meaningful analysis or factual analysis. You know that anyone with Cushing's disease or syndrome will have hypokalemia. It's by fact. Okay, so when you deduce this analysis to arrive at your answer, it is not like you are reading into the question. Though we don't have a straight way to think through a question. It depends on how the question has been asked. Hypokalemia, hypokalemia is a sign of Cushing's disease or Cushing's syndrome. And you can get questions which can actually give you a reason that the patient, though the patient has Cushing's syndrome, but the patient is not hypokalemic. It could be there, depending on how the question has been framed. We also know that hypokalemia is very common in people with Cushing's disease or syndrome. So if the question has been situated in a way that is linked to potassium, then you have to think that way and make your factual analysis. So that is one way you can deduce your things. Okay. We don't have one way method to deal with questions. Even for one same question, you can get just a word being changed, and that will make the whole answer to also change. I normally use this cardio question as an example. When you have a rhythm, let's say one of those shockable rhythms, let's use ventricular fibrillation as an example. You are caring for a patient who is being monitored on a cardiac monitor, and you find out on the screen that this patient's screen is displaying ventricular fibrillation. What is the first thing you will do? Okay, what is the first thing you will do? So the first thing, it depends on how the question has been asked. So you see, look at this question. What will be the first thing you will do? So the first thing you do, let's say, check for pulse. Okay, check for pulse and check, or let's say defibrillate. Let's say in these two, defibrillate. In this situation, we know what we are supposed to do. You perform your assessment first before you do any intervention. If there is nothing like, or in the option with the same question, if the option doesn't include check for pulse or assess patient, and it includes something like checklist or electrode placements, that is also a form of assessment. And with the same question in this same scenario, okay, but with different options, this one becomes your answer. So if you understand the whole concept of a particular question, you can, no matter how the question has been twisted, you can be able to get the answer. Okay. Now let's move on to the next one. We are saying avoid asking yourself, well, what if? Because this will definitely lead you right into reading the question. So when you begin asking yourself these questions, and that is where you set your own questions or you thoughts, you modify the question given before you modify it in a way that will suit you. Then you provide an answer. And funny enough, you will find the answer there and you will think you are getting things right. That is why if you are failing, you will feel with much confidence, and you will come. Some people even go to the extreme of blaming the system. Okay. Some will also associate it with some mythical experience or some myth that they've already heard somewhere. That with this center, people are saying when you write, you will not pass. At this center, you pass more than this. Please, it is never true. Okay. Even for two people or for multiple people who have started at the same time to write this exam, you end up getting different questions from each other, even in the same room. We have billions of questions on the Nclex, and you answer anyone that the computer pops up on your screen. You don't skip any question. You answer as the question comes. So no matter what the question is, you must deal with the question and be factual enough, like we've said before. Avoid asking yourself, well, what if? So, like I said, with the asthma example I was giving, the question told you patient is asthmatic or patient has the condition asthma. Then you end up asking yourself, what if patient can't breathe? Okay, what if patient is having exacerbations? Has the question informed you that this patient is having exacerbations? Of course, no. So that is how you should think through the answer. You can relate it to different questions and in different ways. Okay. All right. The next one to talk about, we are also saying focus only on the information in the question. Please focus only in the information in the question. You see, most of the times when we are doing, we are, let's say we are going through some topics. Most of the times after every topic, you have some few questions about the thing we talked about, so that it guides us to know how we learn, how questions can be formed around certain areas. That is why we do our things that way, so that you don't learn all the abstract, and when questions appear before you, you'll be like, why am I not able to do this question? That is why we've used that strategy, okay, to guide our reviews. So you'll get to know that most of the times, everything you need in the question, you see, if you can recall, Most of the times, I draw your attention to questions and how you should go about them. You see that most English questions, not all, but most English questions, the standalone ones, or the traditional ones. What I mean by the traditional ones are the normal English questions that you know, not case study questions. You get to realize that most of them are in two sentences. Okay, maybe few ones are in three. And you are likely to get some of these simple questions on the English. The English question is not that complicated. It's more content based and a little strategy and an awareness that you have to you have to have before going to take the exam. You find out that most of the times the first part of the question gives you a preamble, okay, gives you an idea of what the question wants. It guides your answer. They will give you a nice preamble. It is usually the first part of the question. Then the last part or the second part of the question, they will ask what they really want you to solve. Okay, let's say a patient who has ascites, a patient who has a diagnosis of, let's say, liver cirrhosis, has ascites. Which of the following? Okay, let me continue. Let me reframe it. For a patient diagnosed of liver cirrhosis has ascites and finding it difficult, or let's say has dyspnea, simple ascites and dyspnea. Which of the following will be an immediate intervention to help these patients? When someone is having liver cirrhosis, there are lots of things that the person can display. Thinking of clotting factors, this person can tend to bleed a lot. Okay. Just imagine all the functions of the liver, they can be affected. And you can relate it to lots of things. Okay. But the question has told you that this patient is having ascites and has even gone ahead to tell you that this patient is having dyspnea. So when they ask you what will be your intervention or your immediate intervention for this patient, what is guiding your choice of answer? It's not anything that can help relieve the dyspnea. That should be your guide, because the question hasn't asked of anything concerning bleeding. The question has given you an idea. So I'm saying this, you can start applying them and you are likely to get lots of questions correct. Pay attention, don't just read questions. Pay attention to the first part of the question very well. It gives you an idea of what they want in the answer. They can mention a diagnosis which can come with lots of symptoms. So when you are solving, look out for the current situation, what the patient is facing, then what you can do to help this patient with respect to the current situation he or she is facing. So that is what we are saying. Please, I hope we are all clear with that.
Yeah.
Okay, thank you. So we can continue. Focus only on the information in the question. Then you read every word and make a decision regarding what the question is asking. I think we've talked much about that. Look for the strategic words in the question. So we have strategic words. You know that sometimes you can get a question of which all the four options are correct. In fact, all the things over there can be done for this patient and it's applicable. But there could be one strategic word that could be a game changer, or that can lead you to getting the right answer. So what are some of the strategic words? I think the last time we went through some of them, but we'll pick it again. Someone's background is making some noise. So let us always use the process of elimination when choices or options are presented. Okay. So when you have eliminated options, reread the question before selecting your final choice or choices, please. And please again. I don't know, but it goes to you who will be writing within this week. I mean, from next week, okay. Tomorrow, God willing, begins another week. So those of you will be writing immediately or later. I'm repeating myself. Read, take your time. You have 5 hours to go through 150 questions maximum. There is no way that you will be out of time unless you waste your time too much on a particular question. And it's not easy for that to even happen. When you get to question 85, or let's say when you get past question 85 at any number, let's say 120, 110, thereabouts, and you are running out of time, please don't rush. Remember, after question 85, and the computer sends you far or gives you more questions. There is one thing that you can be sure that you have not underperformed. That one you can be sure. It's 100% sure that you have not underperformed. Because if you have underperformed, the question would have shut you down at 85 and fail you right away. So it means you have chance. So when you get to 100, let's say any number, okay, any number over 85, take your time. Even if you are left with 1 minute, if you're able to solve maybe the next question correct, maybe the system will decide and pass you. So anywhere after 85, every single question that you answer matters because it's like the system is unsure whether to pass you or not. So it could be that maybe the system needs you to get only 1 or 2 correct answers so that it will pass you. So if you have this thing in mind that I have to finish before the time elapses, and you rush and you do things anyhow until you arrive at 150, you would definitely fail because when you rush, you tend to make lots of mistakes. And after your time is finally up, the system will decide that, okay, so it means you were actually not good. I was just giving you time. So I have to let you write again. Then it will fail you. Please, I'm sure those who even need this message are not even in class now, but all is good. Okay. Uh-huh. So let us take notes so that this thing doesn't repeat itself again among us. Okay. All right. So always pay attention to strategic words, like we said. Use the process of elimination when choices or options are presented. When you have, so why I even came out with all of these things is that please read every word. Take your time. Read every word. Read it word for word and understand. And with the options, read the options too word for word. Even if you spot a correct answer at, let's say, option A, please take your time. Don't rush to pick that answer. Go through the other options too to check out because for all you know, you could get an answer in option D or option C, which could even be better than the option A. And you know the Nclex, I think some of you might have experience. And the Nclex is fond of making answers like that. You can get a question whereby all the options are correct, though, but they are asking you of the priority. So that should make it more reasonable for you to go through all the options before arriving at a particular answer. Okay, and even when you choose your answer, please, most of the times the chair that they use over there are reclined chairs, like a chair that you can sit comfortably in and rest your back. Okay, like an office chair, most of them. So even after you've chosen your best answer, before you hit on the next button, try and read the questions again, word for word, and make sure that that is the answer you really want to choose. And even if you get that question wrong, you know at that point in time, that was your best shot. And you will not, you'll not have any regrets choosing that particular answer. I remember when I took mine, I had similar experience. Like I think my last question or last but one, I was left with two options. Okay. I think question 74, 75. We were doing 75 questions at then. I was left with two similar options and I didn't know what to choose. And I chose the wrong one. So after the exam, that was the first thing I checked when I got to my hotel. And I saw that, yes, I have really had it wrong. And I was okay because I really knew that, at that time, that was the best I could give. Okay. So, and just one question or few questions wrong wouldn't let you fail. No one goes to the Nclex and gets all questions correct. You will have a couple of wrong answers, but the questions, the system will be marking you per your performance, okay, and decide on your fate. So be bold, take your time, face the questions one by one. What will be uncomfortable is that if you rush through question, let's say question that you could have had it correct, should you take your time and then if let's say if you rush through such question and you get it wrong, that is what is more painful, and we shouldn't fall victims to that. Okay. Then we are saying
Mr.
determine.
Please, can I ask
Yes,
a little question? Sorry to interrupt
uh,
you.
no
Okay, there
problem.
are some of our colleagues who have already written, and then when they fail, they get this CPR form that is being given to them through the email, and then the Nclex, let me say, divides the question into 15 parts. So you see they're
Okay.
above the passing standard, below the passing standard, and near the passing standard. One friend of mine got 7 near the passing standard, 5 above the passing standard, and just 3 below the passing standard. Yet
Just
the
three.
person failed. Yes, just 3. I should say, because there are some who sent theirs and then the belows were more than 3. So how I wanted to ask the question that how many above the standard should you get above the passing standard, and how many should you get for the near, and how many should you get for the below? Maybe that could help
Okay.
us.
Okay. So sometimes you don't even know the category of the question that appears before you. You don't know the category within which it falls. Sometimes you don't know. There are some you might know. So it is important you treat all English questions equal. Okay. Do you know that we even have some which we don't score according to NCSBM? There are some questions among the 85 to 150 questions you will answer. There are some questions they are not, they are not scored. But how would you know that this question is scored or this question is not scored? And it will not be written or indicated. So you treat every question equal. With regards to your the pass mark, below pass, and the rest, remember the you see, when you pass, you don't even get a report at all. Okay, that is one interesting thing. You can mute up for us, please. One interesting thing is when you pass, you don't even get a report at all. The answer to your question is that you should get a standard or above standard. Okay, nothing below. Even if, because the Nclex wants you to let's say to be competent in all areas, not some areas alone. Okay, that is why sometimes you can get obstetrics. When you get questions and you solve it, someone's background is noisy. Can you mute up for us, please? You can get an obs question. Then the next one will also come as an obs question again, maybe about 2 or 3 times. Okay. So sometimes, you see, a question throws you all around. It can give you fundamentals. It can give you maybe pediatric question, okay, or according to their divisions. Okay, like basic. I mean, it will throw you all around, all the subjects, mental health and the rest. It can throw you all around. So I'm using the subjects as an example. Sometimes the question can give you questions on obstetrics, maybe one. Then the next one, it will give you another one. The next one, it will give you another one, same as obstetrics. It could mean that the system wants to test you whether your competency level on obstetric nursing is up to a standard. Okay, so it can start from maybe a higher standard, or let's say a hard question type. A hard question type not defined by you, but defined by the system. Mind you, questions that are difficult to you can be the easiest question determined by the system on the Nclex. And there are some questions that the system capitals difficult, but can be easy for you. So all depends on your exposure and how well you've learned. Let's just take note of that part well. An easy question to you can be a difficult question to someone, and vice versa. So that's how the system too works. So let's say, according to the system, they're giving you a question, and that question has been capped as hard question. If you get it wrong, let's say still on obstetrics, it can try to step down to maybe medium and give another question there to prove that, yes, you are good. So if you get that one correct, it can choose to later bring another hard obstetrics. Okay, so even if it tries you at the medium level, and at the medium level to you get questions on the same obstetrics, and you get it wrong, it will now step down to a low level question. And should you get that one too wrong, it can try you in different, maybe some few others. If you get it wrong, then it will decide your fate for that one. Then you carry on. So if maybe the rest of the other areas become very great, it can come back and test you again differently on obstetrics. And if you're able to prove to the question, so depending on, you see, it's all over so. But when you're able to prove to the system that maybe in obstetrics you are good, then it will jump to maybe pediatrics, okay, or mental health medicine. Like that is how it will be throwing you around. Okay, so yours is to master everything and deliver. And you should, if you are able, if you prepare very well, your content is good. The system demands that you get to a standard, not below the standard that they've set for the computer. You reach that standard. So if you get anything below, even one below the standard, it will still fail you. So that's why sometimes people will carry on. Okay, the system will give you more questions after 85. Sometimes to rectify or to prove to the computer that maybe the questions that you had before on a particular system, maybe something was wrong somewhere or you weren't sure about, then it will try to, give you benefit of the doubt to give you more questions. And if with all these multiple attempts, the question will give you during your testing period, you don't prove to the system, it means you fall below what is expected. And it's a system. That's what they've said. It will fail you. And you can never change it anyway. When you fail, you fail. You can do your things, present your complaints and the rest. They will review and play the video coverage that recorded you during your writing, but nothing will change. So take notes. Please, are you okay? The one who has the question. So
Yes,
let us
please. Thank you
perform
very much.
well. You're welcome. Let us prepare well and we can be able to overcome. Okay. Now we are also saying determine whether the question is a positive or negative event query. When you get questions, some questions can be we'll see some of these questions. Okay. Some come in negative event query, some also come in positive. And we are also saying here at the last point that use all your nursing knowledge, your clinical experiences, and your test taking strategies. Okay. Use everything. The knowledge here is what is important, most important to me. Because if questions are asked on, let's say, diabetes, and you know nothing about diabetes, even if you have the best skills to solve Nclex question, how can you solve something that you don't even know about? So that is the practical thing we are talking about here. Okay. So we have to learn. So some of these strategic words are here. So we are saying words that indicate the need to prioritize. The first one is best. Some question can be posed before you, and all of them could be correct, but they'll ask you which one is the best. So in the liver cirrhosis question I spoke about, what do you think would be the best thing to do? Is for the patient's head end of the bed to be elevated, right? Or you let the patient sit up anywhere around 45 degrees is fine, so that you can relieve the pressure by the ascites on the diaphragm, so that patients can be a bit relieved of the dyspnea. Okay, so those are some of the things. And you can be asked early or late. When you get, let's say, lithium questions, and they ask you which, let's say, Madam Mansa is having bipolar disease and is being placed on lithium. Okay, and is being placed on lithium. Which of the following would indicate to the nurse that patient is experiencing early signs of lithium toxicity? In this question like this, you can have all possible options to be correct. Let's say they'll give you tremors, they will give you nausea, they will give you other things. Okay, they'll give you other things, making for You know, with the two examples I gave, tremors could be there. Okay, tremors could be there, but tremors do not count as the early signs and symptoms, but rather the GI symptoms. Okay, being nausea and vomiting and the rest. So that is how you should think about questions. That's why we are saying open your eyes and look at the question well. No one is in race with you. Okay, so look at the question well. The early sign you choose, because all the options over there could be correct. So you choose your nausea, you go your way, you score. And if they ask you late sign, you know that these tremors, they normally become the late signs of lithium toxicity. Okay. And then the next one, essential, which is also something like the most important. Okay. So they want one particular answer, depending on how the preamble and the rest of the question has been stated. First thing to do, we've talked about it, to demonstrate or to give an example. Let's say you are transporting a patient who has chest tube to the radiology department, okay, for maybe a chest x-ray or something. And you realize that the chest tube has pulled out of the patient's chest. What will be the first thing to do? So among the options, you will see something like tape the insertion side, okay, the insertion, or let's say the incision, where the incision was made. You tape it at 3 sides, okay, or on 3 sides here. Tape it on 3 sides. Then the next option would be like cover the site with your gloved hand. Next one would be like cover it completely, okay. And the last one would be like attempt to reinsert the chest tube. Among these options, which one do you think will be the right answer in this my scenario? Hello?
Cover with a sterile gauze.
Cover with a, so tape it at 3 sides with a sterile gauze. Is that what you are choosing as the answer? Can you confirm?
I think the first thing that you should do is to cover it with your gloved hand, but the best thing that you should do is to cover with a sterile gauze.
Good. So you see one question, like what I was saying, just a change in one word changes the answer. For the same options, okay, for the same options there, just one word, first and best. With the same options, the answers will change. So pay attention to the strategic words, then it will guide your answer. The first thing to do is to cover with your gloved hand. And the best thing to do, the best thing, is to tape it at 3 sides. Okay. Cover it with a sterile glove and tape it at 3 sides. Okay. Let's continue. Now, highest priority. They can ask you questions where they will be asking you what's the highest priority. It means all of them could be priorities, but I mean, one can be a highest priority. Immediate, what you should do now, which can't wait. Initial, initial also is like the first thing, okay. Then next. So in this my scenario I gave, after covering the insertion site, okay, or the incision site with a gloved hand, what is the next action the nurse will take? Hello?
Hi.
So who is answering? After covering the incision site with the gloved hand, what is the next thing?
You tape.
You tape.
Yeah.
Okay. Until the doctor or the surgeon who placed the tube or any equal rank can reinsert. Okay. So you tape. So I think we are taking note of some one or two things. All right. Now, most. So they can ask you maybe most important, most something. Kindly mute up for us, okay? Most important, most something or something. Okay. You see here most appropriate or least appropriate. So when they ask you what is the most appropriate option to do in maybe a condition, something like that, someone who is having respiratory distress and all of that, okay, what's the most appropriate intervention to give, and what is the least appropriate? It means things that you should not do, okay, or which is of no importance or very small importance. Then most important, most likely, or least likely. So which of the following is most likely to occur in someone who has diabetic ketoacidosis? Okay, then they will bring options like acetone breath and the rest, and some other sign. Okay, let's say they give you acetone breath, they give you honk, okay, or let's say hyperglycemia, hyperosmolar non-ketotic syndrome. Yes, hyperglycemia, hyperosmolar non-ketotic syndrome, honk. Uh, they give you this condition. You know that it is least likely to occur in diabetic ketoacidosis. Between normal saline and ringer lactate, which of these fluids is least likely or is least appropriate to be used to treat such patients? Then you know which one to choose. Okay. Saline and the rest. Now the primary. When they ask you what's the primary goal of something, that one too could be a strategic word. You should look at it very well. Then what is the most vital something? Okay. So what's the most vital action the nurse can take in a particular question? So these are some of our strategic ways we want to talk about. Okay. Let us take notes. And we have some of the ways that also reflect assessment. When they ask you which of the following laboratory results ascertain that patient has, let's say, heart failure, and they give you BMP of 200, okay, brain natriuretic peptide. They give you that. They give you some other labs too, and they ask you which of these can ascertain that patient has this or something. Then assess. Okay, assess. That one, when the question also make known. Sorry, when the question states it, then it means you should also assess something. To check something out. That one to reflect assessment. Then what information can be collected in a patient who has hyperthyroidism? So it also reflects assessment. Which signs determine that patient is having malaria? So what would the nurse find out about this person with malignant hyperthermia? Okay. What information would the nurse gather? So they can also use that. Can the nurse gather from a victim who is subjected to abuse, whether spousal abuse or child abuse? Okay. Which of the following might identify or can be identified in a patient who has something, something, something? So these are some of the examples. And what will be observed in a patient who is having hypoglycemia? What information would the nurse obtain? Okay. How would the nurse recognize that this patient is having transfusion reaction? These words all reflect assessment. Okay. They all reflect assessment. Now let's carry on to this. We are saying some strategic words may indicate that all options are correct. Okay. You can have some strategic words that may indicate that all options are correct, and that it will be necessary to prioritize to select the correct option, like I was telling you before. Okay, and where that reflects the process of assessment are also important to note. Please, on your Nclex, when you go and write, when you get questions, sorry, we are saying try and prioritize your answers. Okay, you can get all the questions to be correct, but try and prioritize the questions. Even if you don't know an answer to a particular question and you don't even understand anything, most of the times the option that reflects on assessment is likely to be correct. Unless in the question there is something emergent and or enough assessment has been given in the question, then you can go ahead and um, choose your implementation answer. Okay, let's say, let me try and give an example here. In an emergency, patient gets ventricular fibrillation and patient has been assessed to have no pulse. What will be your best action as a monitoring nurse? In this case, you don't assess anything again because the question has already given you a clue that patient has been assessed and found to have no pulse. So why choose check for pulse in the answer options again? You don't choose that one, so you continue straight away. Chest compressions. Okay. So that is what we are trying to say, and there are some of them too. Let's say a patient who is on a ventilator. Okay, or let me say a patient who has tracheostomy tube. Accidentally, the patient dislodges the tracheostomy tube. What will be and maybe the question continues to even tell you that the tube was lying on the patient's bed. What will be your priority action here? You are not coming to assess anything here again. So you intervene straight away. You take it and you put it in. Okay. Remember, when a patient is having tracheostomy, when the patient is having tracheostomy, that incision created at the anterior part of the neck, that is the only hole, okay, or the only opening through which the patient is breathing. Because as soon as you clear that hole, you make the upper parts ineffective. Since the patient is not breathing, though you might have some air going in there, but that is not the active hole, or let's say the active opening that the patient is breathing with or through. So in this case, question has told you that patient accidentally dislodges the tracheostomy tube and it's lying on the bed. The longer you wait, the longer patient suffocates, okay, or respirations become difficult and patients could arrest. So as soon as you see it, you just push it in there. Remember, edema and the rest are likely to happen because of that foreign material which was already there and all of that. That is why you will have to go for just implementation in questions like this rather than, and even I think in the question an assessment has even been mentioned, because the question tells you that though the patient has removed or dislodged the tracheostomy tube, but it can be found on the bed. So it means that assessment has been made and it's been reported to you for you to take action straight away. So those are the few exemptions. Okay, you can have others to also relate. All right. Now let's look at the second point here. A positive event query uses strategic words that ask you to select an option that is correct. So for example, the event query may read, which statement by a client indicates an understanding of the side effects of the prescribed medication? Which statement by a client indicates an understanding of the side effects of the prescribed medication? What is this question trying to tell us? You see, indicates an understanding of the side effects. So this is an example. Okay, this is an example of what? A positive event query. Okay, because we want to reflect on the understanding. Anything that the patient sees that reflects on understanding of the side effect of the prescribed medication. Let's look at the negative query. It uses strategic words that ask you to select an option that is an incorrect item or statement. So for an example, the event query may read, which statement by the client indicates a need for further teaching about side effects of prescribed medications. So look at the second point here. What it means is that, you see this one, anything that the patient sees that is in line with the side effects, that is a positive one, so it goes. But this one, the question is demanding you to bring out anything that the questions, so that the patient says and it's wrong, okay, about the side effects of the prescribed medication. So that becomes your negative event query, okay, a need for further instructions. If you have any question at this time, you can ask. Any question? If no question, then let's carry on. Let's take this example. Today, I wanted to include lots of examples, maybe another time. And as we go through this, we will try and be more vigilant, and even if possible, try lots of questions here, going through all that we've gone through already, and see whether by applying knowledge and with the few testing strategies we can be able to go through. Okay, you will excel in it. A client diagnosed with angina has been instructed about the use of sublingual nitroglycerin. Which statement made by the client is incorrect and needs further teaching or indicates a need for further teaching? You see, this one has given you lots of clues to indicate it's a negative event query. What do you think our answer will be? Who can try? So you see, like I was telling you before, you see that this question, for instance, is in two parts. The first one is the preamble. It gives you an idea of what the question is. Then the question itself is being asked in the second statement. So which statement made by the client is incorrect or indicates need for further teaching? Who can try?
Still.
And I'll need rationale. Mm-hmm. The rationale is what happens you, so don't feel shy. Let us hear you. Hey, with rationale, no one is talking.
I will try.
Okay. Yes, try.
Okay. So with nitroglycerin, the first point, my answer is
That's
D.
weird.
Yes, my
D
answer
for
is D.
dog.
Dog, yes. So with
Okay, your
the
reason?
medication, I know that when the patient is feeling the pain, the patient can take it 5 minutes apart. The first one, then the patient is supposed to call the doctor. Then after 5 minutes, if the pain is still in, the patient will take the second and the third one. So the first point is A is correct. Then with B, I know that yes, it causes a vasodilation. So when the patient takes the medication, there will be hypotension.
Yes.
That can cause dizziness.
W.
So the second point is also correct. So with the next point, I understand that the medication should be yes. We learned that the medication is actually being kept in a dark container, and we should avoid heat and light from getting in contact with the medication because that can damage it. So I know that one too is correct. But with the D, I know that with this medication, with the sublingual, we place it under the tank for it to dissolve gradually. So you're not supposed to swallow it. So that one is wrong.
Okay. I like your rationale anyway.
Yes.
Yes. Thank you.
I
Okay.
also
Any other person?
Yes, I also have something to add. Now,
So you agree with her answer?
yes, I agree with her. The answer is D. But I also have something to add on top of this. I have noticed that with these Nclex questions, you are always torn in between two answers. There are always two answers that are very, very close to each other. Now, for example, like choice A, it says, I'll call the healthcare provider if pain continues after 3 tablets 5 minutes apart. Now we know after you take the first tablet and you're still feeling chest pain, you call the healthcare provider, then you take the second tablet, the third tablet, then you go to the nearest health facility. Now,
Good.
you see, this is where sometimes you might get confused because they're saying that you'll call the health provider after you have taken the 3 tablets 5 minutes apart, while you are supposed to call the healthcare provider after you have taken the first tablet and 5 minutes have elapsed and you have not yet felt the chest pain has gone, and now you are supposed to take the second tablet And then if the chest pain is still there, you take the third tablet. Now, I think this is why I normally get confused, because yes, I know the answer is D, but then I'm like, but A looks like confusing, you know?
It looks like a wrong answer too, right?
Yes, yes.
I understand you. I understand you. So what you are saying is correct. Okay. I think in old books, okay, in old books, this is actually one of these old questions. But the right one or the right thing about nitroglycerin is that, like our sisters are saying, please, when you take, you're supposed to take 3 maximum, and with each 5, you wait 5 minutes apart. So the 5 minutes, within the 5 minutes is where you have to assess and see whether, I mean, your angina is going down or not. Because, you take it sublingual, and the moment you take it, within few minutes, it gets into your blood. So you should be able to work within few minutes. Right. And we are saying, please, I think there are questions out there that say this. We are saying that when you take the first one and your symptom doesn't go down or even worsen, just make an arrangement to be carried to the hospital. Okay. Or you can call your healthcare provider. Any option that brings in the healthcare provider is better. And there are some questions which also say that or which tries there are some questions which try to mean that when you take the first one and according to the question there is evidence that something is subsiding, that is where you can rely on the other two. Okay. And that's one, that one wouldn't be an emergency, and there will be no need for you to contact the healthcare provider. That is why you have 3 attempts to take the nitroglycerin with 5 minutes apart. So first one you take, you see that symptoms are coming down. Then you top up the next one you think, then it means it's being relieved by the nitroglycerin. But you take the first one and it doesn't come down or it even goes worse, please, that is where you call immediately. Do we get the concept now? With nitroglycerin.
Yes, sir. Yes.
Okay. Yeah. But the D, someone wants to talk. Okay. Okay. So by the D, it says I can swallow 2 or 3 tablets all at once. You can't do that, even if you are in severe pain. What is the major or common side effect of nitroglycerin? Come again. Hypotension. Good. Okay. Hypotension. That is very good. That is why you shouldn't combine all these 3 and swallow all at once. Nitroglycerin works on smooth muscles, right, to dilate them. All right. So I think we have the correct answer. Okay. All right. So this is an example of the negative event query. Let's look at this one. I think this one is also a positive event query. So let's look at it. A client admitted to the hospital with diagnosis of cirrhosis has massive ascites and difficulty breathing. Similar to the question that I was trying to say. The nurse performs which intervention as a priority measure to assist the client with
Hello.
breathing. Which one?
Please come back to the previous question. My network went out for 2 minutes. Please.
Who is this talking? Your name? Okay, you can carry on. Can you hear me? Or the person is gone again? Okay, let's look at this. What's the answer?
I'll go for B.
I think we've talked much about this already. Who doesn't understand that the answer is B? So strategically, like how I was explaining it to you. Okay. Uh-huh.
Hello.
So the answer is B. Yes, sir.
Yes, teacher. Please, can you come back to the previous question? I somehow missed it.
Yeah, so I was asking you a question. I wasn't getting any feedback. I thought you were gone again.
Yeah.
Is it this one?
It threw me away. Yeah, the one of nitroglycerin. Where is it?
Okay, please your name.
Yeah. What was it? This one, what was the answer? The answer
Your,
was D, right?
yeah. Can I get your name?
Yeah, it's Abdi Hakim.
Oh, okay. Hakime.
Yeah. It's that
I
one.
pray that your network doesn't go off again.
To survive a issue.
Yeah. So
Yeah.
this one too, we understand that the answer is B. We've already said it. Right.
Yeah. Please come
Okay.
back to the question again. I missed it again. Yeah.
Have you seen it
Let-
now? Uh-huh.
Yeah. Let me read it now.
Okay. You get it? Or you are not reading?
Yeah.
This
I
question,
will read
please.
the option.
If you are here and you don't understand why the answer is B, let us know. Okay. So that we can help you. This is the rationale anyway. Hey, who is that? Who is that? Who is that? Okay, let us carry on. So I think this one is a repetition. Okay, let us look at another thing. Okay, another thing concerning questions. When you are answering an Nclex question, especially with therapeutic communication questions, sentences that normally begin with why or that ask why, you have higher chances of getting them wrong when you choose them as your answer. Okay. More especially in therapeutic communication questions. So do not select an answer choice that asks why. If a patient is in denial, maybe patient has lost someone dear to him or her, and is saying things and is saying things that are not maybe realistic. Okay, try and acknowledge patient's feelings. Okay, try and acknowledge patient's feelings rather than asking why. Why do you think this thing happened? Why do you think no? You don't do that. You don't ask why. And I think most of you have already seen questions like that already. The next one, do not select answer options that requires you to speculate or read extra information into the question. Okay, into the question that isn't there. We've talked about that in a bit. Some questions, especially in select or that apply. I have something to about select or that apply questions. Maybe when we have time, we shall look at that one too. Maybe we can add up to help us. Okay, in SATA. So do not, if you have an option that is trying to give you a tough time, you're not too sure. In select or that apply questions, the last time I was explaining it, it's either you get 0 plus 1 or minus 1. 0 means you didn't attempt at all. Okay, let's say you have 5 options. The correct options are supposed to be 1 and 2. So if you were more confident about option 1, then that is it. If option 2 is giving you a tough time, whether you don't know whether to add it to the answers or not, if you choose to omit it, let's say you don't add it, you will get 0 for that option. If you add an answer option which is wrong, you get -1. But if you add it and you are correct, you get +1 there. So the choice is yours. Okay. So do not select an answer that
Hello, Shaima.
requires you to speculate or read extra information. Yes, sister.
Hello, please just explain yourself again. The -1 and the +1.
Oh, okay. So let's say you have A, B, C, D, and let's say E. You have 5 options for select or that apply. Let's say according to the question, the answers are A and B to be correct. If let's say you are sure of A and you choose A, okay, and you don't know about B, meanwhile the answers are A and B, you don't know about B. So this question is like, according to how they will score it, it's like 2/2. 2/2 will make a total of 1 for this same question. You know that. So let's say if you choose only this one, you were sure of only this option, and you did not choose the option B, you are going to get 1/2. It means you scored 1, and this one was scored 0 because you didn't choose it. But should you choose, let's say, your A being correct, and you chose C as your next one, because this is wrong, they'll not give you 0, they'll give you -1. So SATA questions are +1 -1. So when you get -1 for this, you've already scored 1 and you have -1. So it means for this question, you get what? 0. Do you understand what you are trying to say? So if the options, let's say according to the question, the correct options are 4. Let's say you have the A, B, C, D to be correct according to the system. And you were able to select only 3 answers correct, you get 3/4. 3/4 is a partial mark, but it's more than half. You know that. So this partial marks that you get, they will compound, okay? They will compound, and at the end of the day, they will add up to your score, and that will shoot you up. At first it wasn't like that. The old generation Nclex, that one, if you don't select all options right, the whole thing is marked wrong. Like we give you in our quizzes, we want to train you in that manner. Okay. All right. So let the person mute up for us. Okay. Please, I hope you understand what you are trying to say here. Is it better now?
So, Shaima,
Okay.
Yes, it's better.
I hope the
Okay.
-1 affects the particular chapter question, but not previous answers you choose.
+1 -1 goes for all select or that apply questions.
Yeah, but I mean, it affects only that particular answer. So let's say you've answered one answer correct and 2 answers
You've
wrong.
answered what?
1 answer correct
Correct.
and 2
So should you say you get -1 or 0?
Yeah.
So you see that you get. So let's say if you were supposed to, I get you now. Let's say if you were supposed to, let's say the answers are A and B. And let's say, let me do it again. A, B, C, D, E. Okay, let me say this. Then the answers are, the correct answers are only A and B. And you choose A, C, D, E. Okay, let's say you choose this. What it means is you have only one correct here. So 1 here plus 1 here. Then these ones all become -1, -1, -1. That's your question, right? So if this one cancels out this, then you'll be left with -2 here. I don't think it is being carried forward. I don't think so. I think you will score 0 for that question. Okay. But as long as you have some marks for this question, it will cross out until you are even. I think that's how it's been marked. If they had not introduced this kind of thing, some people would have tricked the system by selecting all options when it gets select all that apply questions. And they would think that the system will just choose the correct aspects for them and score them and leave out the wrong answers. So you can't trick the system. Okay. The next one, we are saying, do not select an answer choice that is based on a scenario you may have seen at work or in clinicals. Okay. So sometimes this one, we are talking about things which are not facts. So let me give an example. Maybe at your workplace, in the ICU, you use examination gloves to suction intubated patients. On the Nclex, or the right thing to do is to use sterile gloves to suction. I hope you're aware. That is what we do. It's only oral suction that you can put on examination gloves. But with endotracheal or tracheostomy suctioning, you put on sterile gloves. So if your workplace has been, you've been putting on disposable gloves to perform such procedures, do not bring it here. Okay, so that's what we've seen. If you've been doing some improvisation at your workplace, please do not assume it to be the right thing done generally everywhere. So that is what we are trying to say. Please, are we okay? All right, let's continue. So the next one, do not select an answer choice that degrades the patient, a nurse, or a colleague. So do not select any option that ends up degrading. So let's say, especially in conflict resolutions, these are some of the areas you can get questions like this. We know that at the workplace or in our settings,
50 minutes away.
when a nurse, kindly
Yeah.
mute up, kindly mute up, kindly mute up. Note that there's an already existing notion that whenever a nurse and a patient get an issue, the patient is always right. Okay. On the Nclex, it is not like that. If you are right, you are right. If you are wrong, you are wrong. It doesn't matter who is coming from, but we have ways to deal with it. If you're a nurse, you have to deal with it professionally. You can't deal with it anyhow. So that's the difference. Okay. So let's say if a nurse and a patient get into trouble and you are a charge nurse, you come to intervene to make sure things are put at the right place. You don't degrade one over the other. Your purpose in this conflict resolution should be even, okay, by helping to correct the issue. But You don't degrade the nurse over the patient and the patient over the nurse. So take notes. It's very important. So that is what it tries to say here. The next one, never try to select an answer choice that involves bringing up potential controversial material. Okay. Never choose an answer that involves bringing up potentially controversial material. So, what example can we give here? There are some answer choices. You yourself, sometimes even when you're about to choose it, you are double-minded. Please, especially in select or data apply questions, it will be better to score 0 by leaving it, okay, than to score -1 by attempting it. If it's true, then you get your plus though. But if it's not true, you get your -1. But sometimes 0 is better than -1. I hope you are all aware. Mhm. Then do not select an answer choice that goes against the general rule. What are some of them? Let me give you a common example. You know that when you are emptying a urine, you don't put on sterile gloves. You use sterile gloves for sterile procedures. And that is a general rule. You can relate it in different ways. I'm just giving you examples and area to relate as and when it comes in mind. But these points, you can relate them in several ways, depending on the question you have before you. So let us take notes. Okay. You know that
Sir, I
you
have
use
a
sterile glass for sterile procedures. Come again.
I have a question, please.
Okay, you can ask.
Yes, you say that 0 is better than -1. Please, could you explain that? Does it mean that it's better to leave a question blank than?
Especially in select or not apply.
Yes,
That is where I'm saying this. Yes, so for select or that apply, it's better if you're unsure, it's better to leave it out than to add it up. If only you are unsure, do your analysis well. But 0 is better than -1. That one mathematically it is true. Isn't it true? And those of you who have already started practicing this, I think even with our select or that apply questions, you have experience. Sometimes, or let's say most of the times, those extra ones you tend to, not all at times, okay, but most of the times, those extra ones you tend to add, they make you get the questions wrong. Who has that experience here? Anyone? Or no one has experience here? So you can try that and see. Please, do you understand me now?
yes, sir. Thank you so much.
Okay, you're welcome. Now, the last one here we have on this sheet. Please, do not select an answer choice that involves leaving your patient unless absolutely necessary. Please, the unless absolutely necessary is even about 1%. So about 99% of the time, please do not leave your patients. It has been written in bold, bolded. It has been bolded here. Do not leave your patients. It's very important. So the last time I was given an example. Let's say you are alone, and at a point in time, patients run into a pulseless ventricular tachycardia. You know, the only thing that can make a pulseless ventricular tachycardia return normal is defibrillation. So with this idea, when the question options give you something like go for the defibrillator and shock patients. You see, it looks like it's a nice option because after all, it is shocking that you shock this patient. But the question is trying to draw your attention on leaving the patients because that's short while. Patient can go or patient can die or something can happen to patients and you might not have any idea. So that's why you always call for help. Okay. So just let this one, guide you. Please, in no matter what it is, do not leave your patient. All right. Think we can continue.
Okay, 20 minutes.
Someone is counting the time. Eh? So the next one, do not select answer choice that tries to persuade the patient to make a choice or agree with something. Please, this one so you can get similar ones in therapeutic communication or so you see, if you have this thing in mind, no matter which area, whatever question you get, because you have this in mind, no one can trick you. So never try to persuade a patient to make a choice or agree with something. Okay? Don't persuade. You see how we do in counseling, you provide necessary options for patients. Okay, let's say patient's relative needs hospice. Though the hospice is the best place for this patient's relative. No matter what, we all know that that's the best place for this patient relative. But do not persuade. Sometimes they will ask you which of the following statements is therapeutic, okay, by the nurse, or if the nurse communicated it to the relative or something like that. So you choose an option that does not persuade. As we do in counseling, you provide factual and necessary information, factual and necessary information that the patient, important information that the patient needs, the relative. Then they will make their own decisions. The next one, do not select an answer choice that tells the patient not to worry. This one too, I think when you solve about 50 therapeutic communication questions, you are going to see a similar question. At random, when you pick any therapeutic communication questions, your bank or wherever, you will see this do not worry thing. That minimizes the patient's concerns and feelings. So it is non-therapeutic. Anytime you see that, do not choose as your right answer. The next one, do not select an answer choice that tries to avoid responsibility or passes it to someone else. So sometimes you can have a situation whereby you get, let me give you an example. I don't know if some of you have seen this question banks before, this question. A question that's maybe at the end of the day, the nurse will refer patients to maybe the chaplain, okay, or something like that to help, especially in anxiety issues or something issue. Please, unless therapeutically necessary, okay, do not avoid responsibility or pass responsibility to anyone. Okay, so if let's say they're asking you a general question that which group of professionals will you recommend to a patient who needs swallowing test? The speech therapist. You see, with this question, the nurse can refer to what or to who? The speech therapist. It makes sense in this question. Okay, but any answer option that tries to, it's like you can do it yourself as the nurse, but you try to push responsibility on others. Let me give you another example. This one is a practical one. Let's say you were a charge nurse and you were going to care for a patient. You found out that there's a spill on the floor. Okay, you found out that there's a spill on the floor. What will you do? You found out that there's a spill on the floor. So you have options like tell the UAP or the cleaner to mop it right away. Then an option like you, the charge nurse, pick up a mop and mop it yourself. Between these two, which one do you think will be better in this case that you are talking about?
You pick up the do it yourself.
Yes, you, the charge nurse, you have to do it yourself. And do you know the reason? You see, there's always a rationale. The reason is that you passing it on to someone and delaying that mop up over there. Another person between that space, another person might fall from that, okay, or an injury can occur. So you don't pass on those things. The next one, do not select an option that is unreasonable or under normal circumstance could not be done or should not be done. So this one too, I think we can relate it to lots of things. There can be options that are unreasonable or under normal circumstance, it should not be done or it can't be done. Okay. What example can we even give here? Unreasonable conditions that under normal circumstance or circumstances could not be done. You know that a UAP should not come close to any form of central line. Okay. Should not come any close to a central line. Or you know that we shouldn't instill water into endotracheal tubes to suction, thinking that we will loosen secretions. Under normal circumstances, it should not be done. So these things are always wrong. Okay. In this case, you nebulize, then you can suction. The next one, do not select answer choices.
Excuse me, sir. Please repeat
Hello.
that. Yes.
Okay,
Please
so
repeat that.
I was giving an example that, you know, there are some, I think, critical care questions around. One says, I think a nurse was trying to suction a patient's endotracheal tube, and I think tube was full of dry secretions. And patients, let's say the nurse attempted to, actually the nurse did, okay, instilled about 1 to 2 mils of sterile water or saline into the tube just to loosen secretions and suction. We do it practically. In most places, you do. Sometimes we call it toileting. Okay, when secretions dry up, it is not something that should be done on the Nclex. The best thing you do is to nebulize patients with even saline. Okay, so that the aerosol which goes into the tube can loosen the dried secretions, then you can suction. Okay, so that's an example I just gave here.
Okay,
You
sir.
get it?
Yes, thank you.
All right. The next one, do not select answer choice that involves doing nothing or waiting for an unspecified period of time unless you're absolutely certain it is the best option. So let's say they can give you a rhythm, okay, a cardiac rhythm, and it might be showing normal sinus rhythm. And should they ask you what will be your next action or your priority action, is to document or to continue to monitor. Okay, at least you've done something. But if you have a choice, that shows that don't do anything, or that is trying to tell you that you shouldn't do anything, or you should wait and postpone. Let me give you an example of the postponing. You were assisting a nurse, sorry, a doctor, to perform a bedside procedure, and you had a call from the lab about another patient whose potassium level is lethal, let's say around 6.5. Okay. In this situation, you tell the doctor right away, you should not postpone. Okay. So some things cannot wait. Even if the doctor is busy, at least try and give out the information necessary. If you don't tell the doctor, even though you are helping to resolve a situation for another patient, if you don't tell the doctor and something happens, indirectly, you have caused it. Okay. So do not select options that involves you doing nothing or waiting for an unspecified period of time unless you're absolutely certain it is the best option, and that is mostly between 1 to 5%. The next one, do not select answer options that makes absolute statements involving words like always. So this is also one trick. Some of the tricks that we are learning. Questions that gives you absolute. Let's say they tell you all it, let's say select among these options. Okay, select among these options a statement, let's say statement made by the nurse, okay, to show if the nurse is correct or maybe incorrect, something like that. And they give you something like all people who run into atrial fibrillation end up getting a stroke. Okay, I'm repeating the sentence again. All patients who run into atrial fibrillation ends up getting a stroke. Even if you don't know anything about that sentence, the fact that all is there, the fact that all is there, if that is when you don't know anything, the fact that all is there, please, the chances of that option being wrong is about 99%. You get that? The probability that that answer will be wrong is about 99%. So take notes. They're not all absolute words like that. I mean, we have some here, always, never. The 1%, the 1%, you can find it in options like, let's say, it is always necessary to wear examination gloves or standard gloves when emptying patient urine. You see, this one, it's factual and it is true. Okay. Or never wear, or one must. So you see, these are like absolute words. The 1% is something which is general, and I think most of us we know if it's like that, it's like that. And let me give you another general one. We must put on, or let's say one must put on sterile gloves when performing sterile dressings. This one too is a true statement. There are no two ways about that. Okay, so those are the few cases. But generally, in therapeutic communication questions, when you get these absolute words, they are likely to be wrong. Okay. They are likely to be wrong. It means you're trying to say something is always like that. Meanwhile, there could be two ways or some other pathways. Okay. And the rest. All right. The next one. Do not select answer options that only cite a hospital rule for its rationale. So, like the example I gave, let's say so you see, let's look at this one, the continuation. If the hospital has a rule about something, there will be an underlying reason. Okay, so which could be either from patient safety or hospital liability, which you should be aware of. So, like what I was trying to say, if you go to a place where I think even there are some places it's dangerously bad. I don't know if I should mention it here. Okay, let me leave it. Maybe for later. Let me use the glove as an example because this is very appalling. Let me leave that one. It is always necessary to use sterile gloves to suction tracheostomy sterile places like tracheostomy tubes and endotracheal tubes. If by protocol your hospital, maybe because of hospital liability, okay, your hospital requires that you should use an examination glove, that is only to your hospital. That doesn't mean it's a general thing that is applied worldwide. So that is what this one tries to say. Okay, so if you get questions that try to maybe reference something from a particular hospital or a particular office, try and relate it to only that aspect. Don't generalize it and use that to make decisions for everyone. So that is what this point is trying to say. Now, the next one, do not select an answer choice that you have never heard of. Okay. So, like what I was trying to tell you, it is better to get, especially for select or data apply questions. If you don't know, okay, it's better to leave it that way. You see, sometimes there are funny ways that you can deal with answers. One thing I didn't capture here, I think so, is that sometimes you can know, you can understand a question though, and with the possible options associated with it, you know that like you understand three of the options, and you know the three options very well, and you can also tell that those three options can't be your answer. But there is one other thing. Okay, there's one last sentence which you are not actually sure. Okay, you are not actually sure, and that could be your answer. So that is one thing I want to add up. If let's say you are sure about the other three options and you know they are unrelated to the question, but you have only one option there that you can't actually tell, that one too is likely to be your correct answer. If only you're able to know that three that you already know. Sure, if you are able to rule that one out. Okay, so that is it. Let's see. Okay, I think we have some last things to talk about here. Additionally, if two answers are exact opposites of each other, one of them is likely to be correct. And I think this one makes complete sense. Let me demonstrate. Look at this example. Let's say you've been given a question that selects among the options which ones are signs of septic shock. In the option, you have I mean, in the options, you have hypotension, hypertension, tachycardia, bradycardia. You see these things? Between hypotension and hypertension, one of them is likely to be wrong. Because a patient cannot have hypertension and at the same time have hypotension. It doesn't happen. So one of them is likely to be correct. And likewise, tachycardia and bradycardia. So that is what we are trying to say. Okay. So take note. You can relate it to any form, hypokalemia, hyperkalemia, or in other aspects. I think that also makes sense. Let's look at the last but one here. If two or more answers are similar, then likely none of them is correct. If two or more answers are similar, it's likely that none of them is correct. Let me see if I can give you an example. Let's say which of the following are signs of, let's say, hyperkalemia. Okay, I'm just making a rough example here. Okay, let me say this. Which of the following are signs of which one should I even give? The examples are blue all over. Okay, let me use the hyperkalemia. What I'm saying, I wanted to say something realistic, but you just let me demonstrate with something. Okay, so that you will understand the principle here. You know that in hyperkalemia, in hyperkalemia, you don't bleed, right? You don't bleed. So if you see something like maybe ecchymosis or ecchymosis, so let me, yes, okay, let me use that. You see like ecchymosis around the navel, and the next one you see maybe petechial rash around the chest, which all show bleeding. Okay, if it's actually a sign of bleeding or a sign that's trying to tell you that patient is bleeding into tissues, you know that you have all of these things here. But having similar things being spoken about, it's likely for all of them not to be correct if the question is not talking about a bleeding issue. Okay, I want to give a very nice example, but it's not coming right now. Anyone who can relate and give a nice example? Anyone? If you have two or more answers which are similar, it's likely that none of them is correct.
John, products now about the consumer.
Okay, so let me give you okay, I think we should leave it there. Maybe later when we start solving lots of questions, some of them will come true. Some of them will come up. Okay, let us mute up. We are about finishing. Okay, let us mute up. We'll finish right now. On the last one here, but take note of these 2 points we've spoken about. They are very important. Okay. On the last one here, we are saying if you are asked to pick which nursing action to take next, remember that every answer choice listed could be a correct action. I've said this over and over. But the question is asking for highest priority action. So you can't go to the Nclex without knowing your prioritization. In fact, every question you choose to answer, and of course, you are supposed to answer every question that appears. So every question that comes up, be guided by your prioritization. Let it ring a bell in your mind. Okay. if you are going with you are going with the notion that you are expecting whatever thing that you've learned ever since you started your preparation to come and all of that, they are all unhealthy thinkings that we normally inculcate. Okay. They are unhealthy. When you're going to the Nclex, don't expect anything. Okay. And as and when questions come, deal with the question. Every question as if that's the only question you are solving to pass or to fail. And giving your best. When you treat every question like that, by the time you finish, you surprise yourself. Okay. You surprise yourself by passing. Okay, so try and pick every question every single question like that is the only question you are solving to fail or to pass. Then give in all your shots. All right. So you can't have expectations when going there. But always, there's only one expectation that I can assure you of. You are definitely going to meet questions that you've never ever seen in your life before, ever since you started your nursing career, even ever since you were born. Even for those of us who have already taken the Nclex, should we go and set right now? We are and all our exposures upon all these years, we will still meet some questions that we've never ever seen before. Okay. So the question is, what should guide you in choosing the correct answer? So that's why we are going through all of these things. Okay. So that at least it increases your chance of getting much correct answers, then ending up as pass for you. Okay, so let us take note of the few ones that we've gone through. I think that will be all for now with regards to our presentation. I'll see if the next time we meet, I'll get the lesson on the SATA. We'll touch on that maybe a little. Then we'll add them up together to solve some few questions and practice and see how we can deduce answers from general questions. So that will be all for today, unless maybe you have a special question to ask. Any question?